Hello and welcome back to GP Video Podcast by Nadia. So today, as you know that I've already wrapped up the topic of screening of colorectal cancer, but the next topic that I would be touching would be prostate cancer versus colon cancer, and we'll talk about that as well. But today, quickly, as we are talking about cancers, I would like to tell you about most common cancer types in Australia. So prostate cancer is the most common cancer in Australia apart from non-melanoma skin cancers. So prostate cancer is the most common cancer in Australia apart from non-melanoma skin cancers. This year, around 24,000 Australians were diagnosed with prostate cancer. So because prostate is an organ which is in the urinary tract of males. So obviously it's the male cancer basically. So it is the most common cancer in males in Australia and in general in Australia as well. So not only in males, in general it is the most common cancer apart from non-melanoma skin cancers. This year, around 24,000 male Australians were diagnosed with prostate cancer. Number 2, breast cancer. Around 20,000 people in Australia were diagnosed with breast cancer, and it is most common in women, of course, but it can affect any genders. So breast cancer is number 2. Number 1 is prostate cancer. Number 2 is breast cancer. But again, prostate cancer is male, but breast cancer can be found both in women and males, but of course it's more predominantly in women, not in males. Okay, so prostate cancer number 1 apart from non-melanoma skin cancers in males, and breast cancer is the number 1 cancer in females, but it can also, and it is the most common number 2 cancer in generally, but of course it's more prevalent in females. Melanoma, which is the skin cancer, it's number 3, and the risk can be reduced by using good sun protection, which is very, very, very important, and being aware of UV lights. Then comes number 4, bowel cancer or colorectal cancer. As I have already said lots of times, that it is the 4th most commonly diagnosed cancer in Australia, with the 2nd most common cause of cancer death. And it is, as I said, most common in people over 50, but it can occur at any age. Same is the case with prostate. Both prostate cancer and colorectal cancer is more prevalent while you age, but it is nowadays being found in as early as people in their 30s, 40s. So we don't have to take them lightly. Then comes the lung cancer. Smoking is the biggest risk factor and is linked to most cases, but there are many people who get lung cancer who have never smoked, around about 25%. So prostate cancer, males; breast cancer, females; then colorectal melanoma, which is the skin cancer; bowel cancer, and lung cancer. So these are the cancers, top 5 cancers. And then we have got non-melanoma skin cancers like squamous cell carcinoma, basal cell carcinoma. So skin check once a year is also very, very, very important. UV lights and sun protection is very, very important. See you tomorrow.